Hi there, this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Welcome to this edition of Facebook Live, and this is week number 6, part 2 of a 2-part series this week where we're covering one of my favorite topics, and that topic is the shoulder, and specifically the rotator cuff and its involvement in impingement issues, especially as our clients are reaching up overhead or carrying things out here in front of them. And in part 1, so if you missed that, watch that before you watch this one, because this information builds directly off that information. I discussed and shared with you how I developed rotator cuff tears and labral tears in my shoulders from doing exactly the things I was taught to do over 20 years ago when I first started rehab and started to learn about the shoulder. I was taught to retract and depress my scapula very hard and very concerted effort. And I got really good at retraction and depression. And what happens is that disrupts the normal mechanics of the shoulder when the shoulder and arm need to go overhead. So in the first part of this segment, I shared with you an important strategy we use with our clients, and that's first to release one of the most important muscles that will pull down hard on the scapular complex and the shoulder complex is the latissimus dorsi. So you need to release that, and then we did the supported wall hip hinge pattern as a way to functionally lengthen that latissimus dorsi and really help our clients start to learn how to get more upward rotation and posterior tilt of their scapula, because that's where you need to get to be out here in front of you and or overhead and maintain proper scapular control. What we found, and this is the exact same strategy I use for my own shoulders to help me start to solve my own shoulder problems with rotator cuff tears and labral tears, is not to overly retract and or depress the scapula, because that again disrupts the optimal mechanics when a client has to come forward with their arms and or learn how to control their shoulders in this position, or when they're doing any kind of pushing, reaching, and or lifting type patterns. So release, so that way your client has the range of motion available to them and isn't overly retracting with their latissimus dorsi. Then what we do is one of our favorite exercises, and this is the exercise that really helped me start to train scapular control, because that's what we're really developing here, is the ability to control the scapula in a more optimal position that we need for functioning out here in everyday life, as well as getting our arms overhead. And that's a band pull apart. So we take a very light band. So this is a purple band. You don't need a lot, because the more resistance your client has, the more they're going to retract and depress. So what we have our clients do is just grab it just narrower than shoulder width apart, with their wrists neutral. And this is an important part of the shoulder complex as well, keeping the wrist neutral. So from here, we just give them a light pull apart from the band. So that way their hands are just in front of the shoulders, and that way we teach them where that wide or long shoulder position is that way. We don't want them to retract this way, retract and depress, because that's the exact opposite direction we need to go when our arms come out forward and function in everyday life and or exercise. So we want to create that width by pulling that band apart, and then teach our clients where that control is. Because ultimately, when our clients are doing rows, this is a position we need them to row in. This is the position we need them to row in. If we're going overhead, this is the position we need them to stay. Is to keep that width through the collarbones, keep open and wide through here, and then teach them how to control that position as they're doing their pushing and pulling patterns. So a very effective pattern. We just have them hold it for about 10, 15 seconds or a couple breaths and just maintain that position. And then we'll teach them how to move from that position, so that way they understand how to keep open and wide through their shoulders and maintain scapular control. One of the most effective patterns we use for our clients as part of our shoulder protocol that we teach as part of the Integrative Corrective Exercise program, as well as the Integrative Movement Specialist program. Now from there, it's always important, you have to integrate that concept into your client's functional movement patterns. So here's an example of how we do that with a row. Now, a lot of our clients are taught to retract and then row. And again, same thing I did that helped me develop my own shoulder issues. So what we want to do is teach our clients to keep this open and wide shoulder position and then row from here. So that way they're rowing themselves into scapular control. So here's how the pattern looks. Open and wide, they'll do a hip hinge pattern to get into the row position, grab the dumbbell, support my other arm. And now I row by pulling open and wide. So again, it's the same position we created with the band pull apart. So it's here, stabilize, and then release back down. Pull, and not pulling too far, so you're not driving the shoulder back into that forward anterior tilted type position. Control the eccentric, and control the concentric motion. So that way we're teaching our clients what they really need, and that's scapular control through functional movement patterns. So we did the release, We did the activation pattern, the band pull apart pattern to teach our clients where the optimal position is. And then we taught them how to row, to do functional movement patterns around that open and wide shoulder position. And that's the strategy we used with all our clients and patients that present with chronic shoulder issues, as well as chronic neck and upper thorax problems as well. And again, that's the pattern I used in the series I used to help my own shoulders and really teach myself how to control my shoulders so I can continue to work as a chiropractic physician, as well as continue to exercise and maintain stability so I have less shoulder problems, less neck problems, and less thoracic compensations as well. So this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education, helping to bring you the strategies, the techniques that we share and use with our own general population clients here in our office. If you're looking for more information, check out our website, www.iihfe. Check out the free video resources we have, as well as if you're looking for more specialized training in the integrative movement system and how to assess, use corrective exercises, and teach the fundamental movement patterns the way our body is designed to move, then check out the Integrative Corrective Exercise Instructor Program, specific for baby boomers and seniors, and also our Integrative Movement Specialist Program, which is starting up here in just a couple of weeks for this year, 2018. Make it a great day, make it a great weekend. We'll come back next week, and we'll see you on Facebook Live. Take care.